to the UBA IQAC webinar series of Government College for Women, Thiruvananthapuram, Kerala. Today, we are having the fourth webinar in the 1 month long webinar journey. Before going further, I humbly request all the participants to kindly mute your audio and video for the smooth conduct of the program. An academic study of the field of aesthetics, ethics, epistemology, logic, metaphysics, as well as social and political. Philosophy is the foundation of critical thinking. It is the art and science that encourages us to think critically about the world, the foundation of all knowledge, and when utilized properly, can provide us with huge benefits. With this opening remark, I invite Dr. Nazneen A., Head of the Department of Philosophy, Government College for Women, Thiruvananthapuram, for the formal welcome and for introducing the respected resource persons to the audience here. Thank you.
Good evening, one and all. As you know, the normalcy and routine way in which we used to approach the concepts of freedom, choice, responsibility, as well as situatedness has vanished. Our rights, duties, ethical dimensions, everything has undergone a revolutionary change. Interestingly, though we own this experience, we feel as if we are not the authors of this lived experience. Dear teachers, research scholars, students, and all those who have joined us this evening, the Department of Philosophy, Government College for Women, is happy to have two of our eminent and popular teachers of philosophy, Dr. G. Padmakumar and Dr. R. Lakshmi, as our resource persons this evening. Our department is proud to say that both were with us as head of the department of our department. For a significant period of time, we had the pleasure to work with them. Presently, Dr. G. Padmakumar is a visiting faculty and Dr. R. Lakshmi is an associate professor at the Department of Philosophy, University of Kerala. Philosophy fraternity needs no introduction about them. And for those who are first time listening to them, their words itself will let you know who they are. Wholeheartedly welcoming our dear teachers to this session. Welcome you, sir, and Lakshmi ma'am.
Thank you, Siddhara Balan and Nazneen, head of the department.
Yes, thank you
for introducing. And shall we start the session now? Or
Yes,
is there any other formality?
Yeah. Nothing, sir. You can proceed.
Okay. Now, you see, the introductory thing, I think we are planning for an interactive session. So the resource person, as you call, may not be boring you much with our deliberations. So this will be more of an interactive session. So in order to start this session, I request Dr. Lakshmi to give the introductory session of this webinar. Dr. Lakshmi, please come forward with your presentation. Thank you.
Okay, thank you, Padmakumar sir.
Yes.
So first of all, let me congratulate the Department of Philosophy, Government College for Women, the IQAC, as well as the UBA team of the Government College for Women for organizing such a wonderful webinar series. My heartfelt appreciation to this joint venture. And I actually feel coming home because it gives me a lot of pleasure to be a part of the fraternity of Women's College, especially a part of the philosophical fraternity of Women's College. Because anyway, my connections and my maybe feelings with the Department of Philosophy Women's College is something which is unique. Anyway, I'm not wasting time, as sir has rightly pointed out. Thank you, Sitara, for your kind introduction and kind words. Thank you, Nazneen, for leading the department into great heights, for taking such pains in organizing this event, as well as inviting us for joining this session. So as Pasmabhagar sir has asked me to do the first presentation, he is my own teacher. So I just comply by whatever he says. So what I'm planning to do is, I'll just make a crisp presentation of 10 to 12 minutes so that he will also get ample time, because we shall not waste any opportunity to listen to his words, and there will be much time for active participation and interaction from the participants' sides also. So let me begin my presentation. So I'll be just throwing some light on what exactly is the role of philosophy in this pandemic crisis. So the title we have given is The Role of Philosophy in Pandemic Crisis. So let us have some thoughts, some philosophical thoughts, what philosophers have to do here. So we will be having some random thoughts. I may be posing certain questions, but I'm sure Padmakumar sir will supplement with those questions and ideas, because philosophy is always something which is open for discussion, where we always feel to have more questions, more interactions, because then only I hope the session will be fruitful. So with this brief introduction, I'll make my presentation. Thank you. So a crisis, to put it simply, is a testing time. This is a proper context for philosophizing, since the pandemic throws up a lot of existential, ethical, and political questions, which are in fact intertwined. So in my presentation, I may be strictly adhering upon three questions, three areas, that is the existential, the ethical, and the political. Here we have more of an academic group of philosophers, and usually there is a feeling that philosophers are doing some kinds of armchair speculation, and they are totally unmindful of the practical realities. But I personally believe in this context of, in this pandemic crisis, philosophy is making interventions, but it is coming like an invisible bug, stealthily, and it infects and affects the practicalities and decision-making or policy-making being played. So it is actually making its interventions, and it is being played out in this COVID-19 times. Doctors of philosophy cannot cure diseases, we agree. But it does not mean that philosophy is only a bundle of theories. It's a perspective, a mindset, a questioning, a way of linking reason with values and emotions, keeping critical faculties with the goal of living and dying well. The crisis is a context for reflexive thinking, wherein stems out alternative models and ways to shape our lives. It is here that the role of philosophy comes. This is the time of kairos. That is the opportune moment for philosophers to intervene. Now, the basic question is how to intervene. So I'm directly coming to the point. We know and we respect the tireless services done by the team of medical professionals, scientists, and civil servants. There's no doubt about that. They are in need of an immunity of a special kind. Philosophical reflections offer them that unique immunity which will serve them from rash healthcare, economic, or political decisions. I think it is the key role which is silently being played by the philosophers in this context of pandemic crisis. To put it in very concretely, each and every individual has a moral responsibility to do what is fair and just in our duties and responsibilities. Now, I don't want to restrict the responsibility and the duties to the medical professionals or the scientists or the civil servants. But every citizen, every human being has got a duty or a responsibility to be fulfilled. What is that? So we are all a fact of each other's reality, and hence we share responsibility for one another. Here we can remind, or we might be reminded of, because students are here, so they know Kant's third maxim: act as if you are a member of a kingdom of ends. And this is the time wherein you have to remember the Kantian dictum. The Bhagavad Gita also exhorts Parasparam Bhavayanta Shreyam Paramapapsyata. So we study all these things in order to practice this time of pandemic or in the time of crisis. Now we have a feeling like someone else is to take our responsibility. What I mean is, so in this particular situation of pandemic crisis, there may be a feeling, or at least for some persons, it is the responsibility of someone else to take the responsibility, or be it the government, the medical professionals, or the authorities. It's a truism that they have to play a key role, but this is a time for shared responsibility, where it shall be like each and every individual is facing the situation boldly and takes up the situation in one's own shoulders. That is really the need of the hour. Maybe we are not directly affected by the virus today, and so we may feel safe. I put safe within inverted commas. But in the long run, it poses big questions and new threats. Herein lies our responsibility to think critically, positively, and with a concern for the other to find alternative ways of living and existence. And now I would like to pose certain questions. Why the pandemic has become a crisis, an existential human predicament? Why do we feel so that it's a predicament? Whether there were any failures, or have we made some failures, at least in our perspectives? Maybe because we have made some failures in our perspectives that today we feel we are in a crisis. So it is the time to think about those failures. So what are they? Judith Butler once said, I quote, philosophically, we have failed to think beyond false narratives of ourselves, hermetically sealed and safe. We have failed to face the way in which we are constituted in relationality, implicated, beholden, derived, sustained by a social world that is beyond us and before us. Unquote. So this is really the failure. Because we often forget that we are only a part of the biotic system. The epidemics has taught mankind about this false narrative of safe and secure. So we have a feeling that, or we had a feeling at least, that we are so secure in this universe. Because man has conquered everything. But now we realized that we are unsafe and insecure before a microbe. It is time to change our narratives and perspectives. Here lies the key role of philosophy. Another thing, why are we so weary about this situation, that is this lockdown? Like we feel as if we have no freedom, etc. We feel like we don't have any kind of a social distancing. But maybe since we are distant socially, it has given us another opportunity or to redefine or to rethink about exactly what is social relation. Because it gives another way of making social relations. Okay. I would like to add a quote from the Plague of Camus, written in 1947. So this plague was written by Albert Camus in a similar situation of pandemic crisis of plague. I quote, when a war breaks out, people say it is too stupid, it can't last long. So this is exactly the feeling now we have. Now I continue the quote. But though a war may fail to be too stupid, that doesn't prevent its lasting, unquote. So the truth is, the epidemic is beyond human imagination. See, we always want to measure everything with our finite intellect. And we human beings have the confidence or the overconfidence that we can measure everything. We can measure everything in this life. We can know everything in this life. But actually there are instances or there are moments when we realize that things are beyond our calculations. And the pandemic has really taught man that things are beyond the measures of human beings. But I'm not going negative. We have to understand and we have to see the truth about life. Life is uncertain, or we can say uncertainty is the very law of human life. This is the message taught by Buddha and other great philosophers, but it is the very condition of human existence. I think once Simone de Beauvoir was asked why ambiguity. She said, ambiguity is the very condition of human existence. Only because there is uncertainty that man exists, or it is the context wherein man learns how to live. Once Swami Vivekananda was asked, what is life? And he said immediately, I quote, life is an unfoldment and development of a being under circumstances that tend to crush it down, unquote. So we have to develop and we have to unfold. But since students are sitting here, I'm telling them, but don't always expect that. Always you can have smooth life will be smooth, or you can swim across very smoothly. There will be hardships. So that's a truism. But that true hardship is actually giving us the strength to face the existential situation. Now I move on to the next question. That is, the pandemic has changed the world, but not the simple fact of human dignity and the shared realities of human condition. That we must remember. It's the time for happiness and love. It's the time to see and care the other, a moral obligation for the other. We don't need heroism in this context. Why? The need of heroism, but the normalcy as a human being, as an existing individual. So here again, I take a quote from the Plague of Camus. He says, I feel more fellowship with the defeated than with saints. Heroism and sanctity don't really appeal to me. What interests me is being a man. So being a man, a concrete existing individual, So that is really what we have to be at this moment of crisis. Now, as far as the epidemic virus is concerned, we are all in the same boat. There is no difference. So it affects everyone. Every life is dignified and valuable. Philosophically speaking, the coronavirus has given us an opportunity to come out of the divisive identities, the social constructs, the false narratives that we had or that we have. In other words, identity is a metaphysics / a social construct, a false narrative that the coronavirus can effectively cure. So there is something positive about this coronavirus, I believe. It could, we can take this situation as a situation where our false identities are being crushed. Now, getting to the new normalcy means what? When we get a relief from the crisis, maybe we hope we shall be men of attentiveness. What is attentiveness here? Undoing oneself in order to make room for other selves in one's life. The sacrifice of the first contact health workers teaches an ethics of the other, an asymmetric relation of the same to the other. So we are seeing daily. We are feeling it daily. So it is not the theory, but it is the real fact which we are seeing. Now, the pandemic has helped us to revisit the existential questions, the ethical questions, but will be complete only if the third leg is also touched. So I have tried to touch the existential and the ethical aspects. But the third leg is, because whenever we speak about the ethical, maybe it will be leading to the political. The most recent work on pandemic crisis, written by the contemporary philosopher Slavoj Zizek, provides an opportunity to bring radical changes in our societies and the world at large. In his narrative style, so the book is presented in a narrative style, it's worth reading. I'm thankful to Dr. Gasper for introducing this book to us. And in his narrative style, he presents the situation as triple crisis: the medical, the economic, and the mental health. He makes a call to the global leaders to unite and develop a global healthcare system. What is at stake is my personal opinion. The kairos of the state shall be in providing more funds and resources to secure public health, at least in the future times. We shall see that more and more funds or more and more attention is being given to protect or secure the public health system or the health of the citizens. Let me conclude my words with the brilliant exposition of what is getting back to normal means. So we always say, so getting back to normalcy or the new normal. I again quote the words of Zizek, quote, "It should be a disaster communism as an antidote to the disaster capitalism," unquote. So we hope the new normal be a communism imposed by the necessities of bare survival. Again, one more point which I wanted to bring home is this new normalcy shall be also a phase where there will be more of what I mean, science-human interface. That is, it gives an opportunity to see that no scientific inquiry is independent of social and political factors. For example, when we have scarcity in medical resources, how to allocate them to the needy, how to make decisions there, because every life is worth. So it is here that the ethics makes its way, the socio-political factors count. So this is the time when we have to think about all these things. So a lot of speculations are in fact necessary, because only from theories or from speculations that practice will come, that policies will come. Therefore, I personally believe philosophy has a great role to play in this time of pandemic crisis. Thank you. Sir?
Thank you, Lakshmi, for a beautiful presentation. And the theoretical part, you have given a beautiful presentation about the philosophical tools, philosophical models. And today I am very happy that UBA platform is using this seminar. And I am in the list, I can see our former teachers, even this. Can you hear me?
Yes.
Oh, okay.
Yes, sir.
Okay. Kamini teacher is there and Sunda Woman teacher was there, our former colleagues, and I'm very happy to hear that. Directly go into this topic. And Dr. Lakshmi has given the basic theoretical aspects, and I will go into the practical aspects or some social reality aspects. So as per the Constitution of India, you see, fundamental duties under Article 51A(h). It shall be the duty of every citizen of India to develop scientific temper, humanism, and spirit of inquiry and reform. This is a basic aspect in our Constitution. So we should develop a scientific temper in our life. This is the duty of philosophy, which I want to say in the present social situation, in the present crisis. And we should not be carried away by conjectures. Those who study philosophy of science will be knowing about the refutations and the conjectures given by Popper, etc. We cannot accept, or you should not accept inference without any sufficient proof. When we come to this COVID-19, I just want to call your attention regarding how this disorder has come. One basic aspect which I want to highlight. They are usually technically called zoonotic disorders, that is coming from animals. And we have Nipah, which has come from bats, and SARS from civet cat. Civet cat, you know, in Malayalam very good. And COVID-19 also from bats to human beings. So this shows that we have to be careful about the environment, about animals, and about our fellow human beings. So we have to protect our environment, protect our animals, and protect the human beings. This has been, we have got very beautiful models in philosophy, especially in environmental ethics, environmental philosophy. We have got these issues related to environment. And I will come back to the scientific number again later. Okay. You see, during lockdown, we are undergoing lockdown now. One of the basic aspects in lockdown is that we should provide basic drinking water, facilities for washrooms, energy, and facilities for communication and information, and small and steady income. I think you have to note down the last one, the steady income for every individual. That's a very significant aspect which you have to think about. In this situation, you look around and see what is happening to your neighbors. This is a point which you have to note down. And attitude of people. You have to develop some kinds of attitude to people, because that is very significant. The attitude is very significant. How we develop attitude towards your fellow human beings. Many people are carried away by unscientific thoughts and it's causing so much of problems. I call your attention to one of the incidents which has taken place recently in Chennai. One neurosurgeon, Dr. Simon Hercules. I think most of you will be knowing from the news. And he was a very good person with the humility, philanthropy, and he has died of COVID-19. What happened is that when his body was about to be buried, people attacked the relatives, fellow doctors, and they could not do it in a proper way. And people attacked them with the logs and weapons, and many persons were injured also. The fellow doctors as well as the relatives, especially his wife and children, were also attacked, it was said. The emotional issue that we have to see, as Dr. Lakshmi has pointed out in the last aspect, the science-human interface, we have to see why these people are behaving like this. We live in a society where stigma, in philosophy we can use a term called stigmatization. Aitam, in Malayalam we can call it, or a kind of social isolation. Why the stigma is there? When it happened in Chennai, our educated people from Kerala said that it will not happen here. But what has happened in Kerala? We have faced similar situations in cremating the body or burying the body. We have problems there in northern part of Kerala. Issues, and I think you have seen many issues where people are preventing the burial and how this emotion has to be displayed. That's a very significant aspect. This is an aspect which we have to take into consideration. How people react. Because I am coming to the social reality, the situation what is presenting here. The stigma has to be taken away. This is happening from the educated people. This we have to think. This is the duty of philosophers, educated lot, to think of it. And you see some of the many people are contributing for this activities associated with this COVID management, helping people, helping authorities. What is happening there? This is a point which you have to see. We have enough philosophical tools. That's my point. Nothing is left there. We have got a very rich tradition. We have got very good philosophical models which can be applied for our human behavior. We should be concerned about others. We should have empathy. We should say. We can say many philosophical aspects, but that is not the thing. How we have to practice it. The stigma is one of the important, stigmatization is one of the important or dominant things which is happening in our society. Whether it is in, not only in Kerala, throughout India, we are observing it. It is the duty of the educated lot to react and to reform the stigmatization and make people aware of this. I used to say that this kind of paradox usually exists in our behavior. We speak one thing and practice it another way. I'm not saying about the individuals alone, but the community as a whole, especially the educated people. It is a duty. The education, you see, the philosophy of education, we have got very good theories. And in ethics also, we speak of so many ethical theories. But what is happening in this pandemic situation? Many people are behaving in this manner. This is one of the basic question, basic issue which we have to reflect on ourselves. This is what we have to do. So the philosophical element we have to see about this. And people, many people, you see, I am also asking you to reflect upon certain situations. You see, COVID has been affected, and it has been directly and indirectly affected. Some people are directly affected and they are affected by the disease. Others are indirectly affected. Indirectly affected means the persons belonging to the family. Some people are isolated due to this particular situation. We should be aware about their particular situation and confusion, and we should think of certain plans to help them. That's a basic reflection which we have to do. Whether we are doing something for their rehabilitation. This aspect is very significant. Nowadays, you see, one of the significant problems which we are facing now is that due to lockdown, the last part which I have, that's why I have mentioned about the important aspects which you have to be careful or to be cared in lockdown is the small and steady income for every individual. That part has to be addressed. Even though authorities are doing certain things for them, that's a very significant aspect. I am asking you a question whether if some of you may be having problems, or some of you have the capacity to help others, and you may be doing it. As philosophers, it is our duty. Look around and see what is happening and make some kind of measures to help them, at least one person. This is a basic question which we have to take into consideration. As there are many students, I am just giving you a particular aspects related to a recent movie. I think most of you are aware of Sushant. Recently has got a problem. He has the death of Sushant, and I think most of you have seen that movie, Dil Bechare. And in that movie, you see how we have to develop an attitude. Even though both of them having the hero and heroine having problems, they developed a kind of positive attitude towards life. That is very significant. We have a responsibility towards ourselves, responsibility towards our fellow beings, responsibility towards future generations. There we can use so many philosophical models. But the only thing is that how you practice it, how far you are able to practice it. And another very significant aspect is that many people, many patients, commit suicide during this period. That's a very significant area which we have to address. How can we help them? That's a very significant aspect. Have you thought about it? They feel depressed. What happened to them and why they could not deal with that particular situation? Because they are facing a new kinds of situation. Some are very much panic, and how can we overcome this panic? This is a social issue. We have a great role to do this in this particular situation also. So if you are relatives or if you are friends having this problem, you can at least contact them. You can have a conversation with them, and we can interact with them properly and do the things necessary for it. This is, you see, I'm not speaking about any theoretical part. I am speaking about the philosophy of action, how we act. Kashmir has mentioned about the maxims of morality, and you should have some imperative, unconditional commands. And except the maxims of morality beautifully says about these aspects, how you should work. Or you, as you said earlier, Bhagavad Gita is saying about the things how we should work in a particular situation without selfish interest, selfish motive. All these things are there. Where we are doing it and how we are doing it, that's a very important issue. So in pandemic situation, it is the duty of the educational lot to interfere in our own ways and act for the benefit of everybody. So in this context, I'm just asking you to reflect upon certain questions. As Lakshmi has raised some questions, I am also raising some questions for your comments and discussions. Not simply about you. I think usually in this seminar people ask questions, but I ask the questions. Do you have any problems during lockdown period? Whether, another question, whether you are participating in any of the programs related to COVID-19, COVID management. Are you aware of your neighbor's problems? Another question. You think of it. Don't answer this. Think of this and make some kind of reflections based on that. Whether we have got, I mean this, whether you have got some isolated persons, your neighbors are isolated, you have to think about it. Or you are isolated if you have a problem like that. That's why I put the first question, whether you have any problems and whether somebody was there to help you. And what is your attitude towards patients and their relatives? This question is very prominent because you see in Delhi itself, one of the metropolitan cities, even the health workers, especially the medical nurses, could not get a proper accommodation because they are treating the patients. The doctors were neglected. The medical staff and paramedical staff were neglected by our society. This is an educated society. It is our duty to do this because they are doing with the life and death directly. We are sitting in a room and discussing about this, but they are actually participating in the pandemic situation. This is the problem which we have to discuss in detail. This is how we have to do. And attitude we have to develop. And some of the persons they have said that you have to vacate the house because you are treating the COVID patients. This is the attitude. Happened in Kerala also, in many places also, we have problems like that. That's a serious issue. Your attitude towards other persons, even the burying of the body, I told you about the issues raised by the people. Then another thing which I want to ask you is, do you follow the health protocols or the protocols given by the authorities? What do you think as the best means to control this disease? And this is a basic question which you have to take into consideration. These are some of the basic questions. I think you keep it in your mind. And with reference to your attitude towards patients and relatives, you should not be carried away by conjectures. So I want to highlight that particular point once again. Many people are doing like that. Even when you get messages, WhatsApp messages, so many messages are coming. You can eat some, drink hot water, eat some turmeric, and the COVID will go away. By doing this, people will walk around without proper protocol and they are infected. It's our duty to have a scientific outlook. The role of philosophy is, I used to say that, a demystification. You should not mystify things. Now we talk, we see each other because we are in a scientific platform. It is not by any rituals or by prayer alone. They have a role, I don't undermine that. Through scientific platforms, people are actually propagating this kind of unscientific thoughts. That's also very dangerous, highly dangerous. That we have to promote scientific temper, research and development. And recently, one of my friends was working formerly in Kannur University in environmental studies. He was recently working in South Africa, and he made some research regarding the infection of this pandemic, this COVID, this virus. And he made a great hypothesis, and his article he made some research, and his article has been accepted in an international journal. Recently I got it, yesterday only I got it about this. And his name was Dr. M.K. Sadish Kumar. He is basically from Faculty of Physics. He is doing some research in, and some of them, if Rajivan is here, they will be knowing, and I think Lashmi or Nassim will be knowing. He was there formerly. Vijay will be knowing also. Formerly, once he came to our seminar in Women's College. He said that during lockdown period, there will be less air pollution. Most of you will be knowing. When air pollution is less, the infection of or propagation of this virus will be also less. Because when there is air pollution, the dust particles in the air will act as a medium. When you do some kind of coming out of your mouth, this kind of particles, that will be left there and it will be easily propagated. And there is a theory which they are developing. Lockdown is usually treated as a period for doing certain kinds of preparation for the next coming thing. Now, in our present situation, we have to think about the particular situation and what is happening now. Now, the day by day, it is increasing. It is our responsibility. As individuals, we have a responsibility to ourselves. So, these basic questions, which I have asked you, just reflect upon it and do something in a positive, so that we can work together for a better future. Only if we exist, then only we can do for others. And we should have concern for others. We can use so many philosophical terms for that. We can have psychological terms, empathy, or a kind of reverence, duty. So many terms can be used for that. It's not that mere, as has been remarked by Dr. Lashmi, it's not mere armchair philosophizing that is required now. That is required for basically, but we have to act, practice. We should have a philosophy of action for the benefit of everybody. We can do wonders because ideas can be created and ideas can be implemented properly. And we should have a scientific mind, and we should promote research and development. Then only, because we are, this is also, the platform I told you, is also a product of the research and development of scientists. And science and philosophy should go together for a better future in this pandemic situation. So we have to act. I think it's almost time for winding up this. I mean the discussion, and you will be asked to participate in the discussion. Okay. Thank you everybody for your patient listening. I have given some thoughts for your reflection only. I have not given anything new because things are already there. So basically I say that's a philosophy of action. There should not be, one more thing which I want to highlight is that there should not be any gap between theory and practice. On this gap can be reduced, we can make wonders. whatever crisis we come across. We should avoid stigma. Thank you all. I think next we'll have some responses from the participants.
Thank you, sir. I request Dr. Vijay to take the questions and share with the resource persons.
Thank you, Dr. Sitara. It is my pleasure and privilege to pose the questions that have been given by the participants to the resource persons. Let's hope to have a very fruitful and thought-provoking discussion. I shall begin with the question posed by Dr. Godwin S.K., Associate Professor of Economics of our college, Government College for Women. The question is this. The question is posed to Dr. Lakshmi. He asks, don't you think that people are becoming more inhuman because each individual thinks the other is a threat? People are afraid to be close and mistrust dominates the interaction. He wishes to get your opinion on this. Dr. Lakshmi, please.
We will be taking questions one by one, isn't it?
Yeah, certainly, yes.
Okay. Okay, good evening, Godwin, Dr. Godwin, sir. Good evening. So anyway, thank you for participating in the webinar. So people are becoming inhuman. I think we cannot generalize that. I agree with your point in the sense that there is, in our society, there are people who behave in such inhuman ways even during this period of pandemic. Even sir has just now mentioned. And we can also see people rushing to the markets and irrationally out of fear, they're collecting more and more goods and bringing them to their homes. Of course, sometimes people they are breaking the COVID rules and they are behaving in inhuman ways. But we can't generalize that. Just think about the health workers, the kind of sacrifice which they are doing, because they also have family, they also have kids, they also have their brethren. Even they are ready to sacrifice. How many medical professionals we have seen, they are affected by this coronavirus only because it was their duty to serve or save the lives of the affected patients. I don't think we can generalize that. Okay, thank you.
The next question is also directed to Dr. Lakshmi. This comes from Dr. Soumya, who is an assistant professor in SN College, Kollam. She asks, I would like to hear the application of distributive justice in terms of allocation of health resources and services. Sometimes, even in Kerala, health resources are denied for needy in the midst of COVID-19. She has requested you to respond to this particular situation. Thank you.
Thank you, Dr. Soumya. Thank you for your participation and thank you for your question. I think at the outset of my presentation, I have referred to this point, that is fair and just distribution. Whenever we think about the distributive justice of John Rawls, what is coming to our mind is fair distribution, fair and just practices that we have to do. And Rawls, we know, he gives much emphasis to what is called a meritocracy. He always wants to see that whatever things we are doing or what is justice, what is most beneficial to the least advantaged group. So this is Rawlsian position. And I think we have to see that such distributive practices or practices relating to this theory of distributive justice, it has to be accepted and adopted by the health professionals or every policymakers or those who are in their respective positions. Because I think most of the things we cannot impose from outside. These moral situations or Rawlsian justice, distributive justice is in essence It's an ethical justice, not merely a political justice. And that kind of an ethical attitude can come from within only. Okay, thank you, Soumya.
Yes, the next question is from Dr. Girilal. He has sought the response of the role of philosophy of science in the current pandemic situation. And he has posed the question open-endedly to both the resource persons. I request both the resource persons to respond to this query. Thank you.
Sir, hello.
Yes. Yes.
Sir. Would you like to comment, sir?
Vijay, what was the question? What was the comment? Vijay, please.
The question was role of philosophy of science in the current pandemic situation. What is the role that philosophy of science has to play in the current situation?
Girilal, that was what I was telling. I didn't mean that, I didn't use that philosophical terms only about the social reality. The approach, that's why I used this constitution. You remember that in the beginning, I tried to make a scientific temper we have to use. Because in this particular situation, philosophy of science deals with, I'm not going into the details of the philosophy. I have mentioned about the conjunctures. You have seen that. Science is one of the basic aspects which deals with the basic product is verification theory. So science is using this basic principle. In the initial stage, they have conjectures. And from that, we go to verification and proof. Science has got a great role. And one point which I want to highlight is that the unscientific thought of educated lot is one of the greatest problems that we are facing. Not about the illiterate persons. Illiterate persons having an unscientific thought, we can actually deal with him. But the unscientific thoughts of the educated persons is creating. Is the philosophy of science have to do a lot in this particular situation? We have to reflect upon the critical aspects of it. There are so many philosophical theories, philosophy of science theories. And, you know, the proposed theory of falsification. Falsification, you know, the theory, verification, and falsification, the interpretations. I am not going into the interpretation now. Only thing we should have a scientific temper. Then only, because many people are propagating unscientific thoughts through WhatsApp or any kind of message without thinking. You should have reflection. We have given rationality. Rationality should be there. That's a basic thing which you have to do, Girilal. That's a point which I want to highlight in this generally. I think Lakshmi can add something more.
Yes, sir. Thank you so much. So I will just add to what Padma Mahar sir has said. So today we have what is called science studies, which is emerging like anything. We have sociology of scientific knowledge and the strong program by David Bloor and all that. The key point is always we have to see that the scientific inquiry is carried out in relation with the social and political factors only, or they always speak about the human science interface, because the philosophers of science nowadays, they are trying to address those issues where science is also something where we can see that it is also becoming something like civilization centric, or I mean, it is also in the hands of some people, or it is for the benefit of some people. There also we can see in terms of either gender or race, the benefits of science or the possibilities of science or the possibilities of researches in science are being sidelined. So science studies is asking these questions, and I think it's a relevant question that you have asked. Thank you, Giri.
Thank you, resource persons. The next question is from Muthu Kumari. The person has assumed that philosophy means rules and disciplines in our life. How does this reflect in the current pandemic situation? So the person has actually assumed that philosophy is a set of rules and disciplines in life. So in the light of that, the person has requested the resource persons to reflect on its relevance in the pandemic situation. Thank you. You
see, philosophy is not related to rules and regulations only. Philosophy has got so many dimensions. And with reference to axiology, when we deal with the values and ethics, or with the logic, there are rules, but we can apply it. That's a basic problem. Philosophy has beautiful tools, but problem is whether we are applying it or not. That is the issue. That's the real issue. We are not lacking anything. We can do textbooks and we can make speeches. That's possible. That has to be applied properly. Then only it will be for the benefit of human being. As I told earlier, you see there is a basic issue which we are facing now. I told you about the stigma. Why the stigma is coming? Because we have to develop our thought process in a rational manner, based on certain rules and regulations. Rules and regulations, especially in ethics, we deal with certain kinds of norms, based on certain norms, how you should behave in an ideal situation. Actual and ideal. There's a philosophical dimension that is usually there. How there is a gap between the actual and ideal. How can you reduce this? This is the basic theoretical position which we can say about this issue, and we can put this into practice. The ideal, actual gap have to be reduced in any situation. Because the ideal is always there, but the actual is far from the ideal. That is the problem. I think this only generalized this aspect. What from the general statement I have given this particular rules for that. We can apply this. All aspect of philosophy can be applied for this thing, including the analytic philosophy, the linguistic philosophies, modes, the language of communication. People who are in stress, we can communicate them with our language, with our behavior. But whether we are doing it or not, that's the issue in this particular situation. How the stigma can be overcome in a state like Kerala or in a country like India, where many people are educated. So that can be used. The question is a very interesting question, because that can be generally applied in any context. Lakshmi, want to make some comment? You can do it.
No. Sorry, you have beautifully answered that question, so we can pass on to the next question.
Thank you, resource persons. The next is a very thought-provoking query from Dr. Uma Jyoti V, the head of the Department of Economics of Government College for Women. She has asked what are the philosophical insights on the so-called duality of life and livelihood? I repeat, philosophical insights on the so-called duality of life and livelihood. Thank you.
That livelihood is very significant. You see? Livelihood is a very important issue, I think, from economic standpoint also. You see, philosophy, I don't know whether I am correctly answering this, responding to that particular issue, because humanity is there in all our traditions and philosophical theories. The aspects of humanity is there, and where we are dealing with the livelihood of the people, that's very significant, because in this particular situation, as I told you, many people are suffering because they have got problems with their livelihoods. How we have to address that? The government is doing it. That's a major issue, because philosophical models are there. Very sufficient models are there for this thing. From ethics, we'll get it. Even from Indian philosophy, we have got very beautiful aspect about humanity and how we have to deal with this humanity. But the problem, as I told you earlier, as I mentioned earlier, is the issue of this kind of disparity or a kind of gap. Or I can use another term, always there is a kind of paradox. Because philosophy actually is a wonderful discipline which have got this beautiful ideas, and how far we are able to practice it in a particular situation, and how far we are able to be successful in implementing this for the benefit of humanity is a basic question that we have to address. Now, let me want to say something.
Because it is Uma teacher, I just at least want to say hello to her, because I'm very happy to see her this evening joining our session. and also interacting with a question. I just would like to add something from the Indian tradition. That is, the Indian tradition speaks about Purusharthas, or the 4 values of life. There we speak about Dharma, Artha, Kama, and Moksha. There, this question of Artha is something which is related to livelihood, we can say. But there are also certain other three important aspects which are related to life. But all these are integral to each other. So thank you, ma'am. Thank you so much.
Okay, we move on to the next question. This is from Reshma IR. The question is posed to Padmomar sir. She has asked that the people of our state claim that we are all educated, and even throughout our nation we claim that we are educated, and still we behave in a very careless and irresponsible manner. Now, how can we create a kind of awareness in the people in a philosophical way? That is the query. Thank you.
That's a very interesting question. You see, the question which you have to ask is whether it is a problem with education or problem with our own problem, or our own problem. Problem of the individual or problem of the education. Education has got a problem. You see, there is a very there are certain wonderful observations made by researchers that education and humility, education and creativity, they do not go hand in hand. You see, recently, you see, I have witnessed one incident in Kerala, I think somewhere in middle Kerala, where an accident has occurred. A lady doctor, she actually struck a motor vehicle, and the motor fellow has fallen down. And she came out, being a doctor, tried to help him. He was wearing a helmet and bleeding. All of a sudden, another car came. That was also a lady doctor going to the hospital. She also came out and tried to lift his fellow and do some first aid. All the people were watching this as seeing as if they are seeing a shooting, film shooting. Finally, somehow they managed to get him into an ambulance and take him to the hospital. And the hospital, I think 30 minutes bleeding, and he has passed away. What is the role of people? All people are witnessing this were educated people, mostly, maybe. What happens? Why this is happening? That's the basic question which you have to ask. We have to reflect upon it. This is the system which we have to develop. That's a kind of, this is also a kind of stigma, and also attitude towards people that we have to develop in a positive attitude. Otherwise, things will happen like that. Because in this is a very, I think it is a sorry state of affairs. We should have a reflection upon it. And in our education system also, we should come more with this kind of philosophy of action, philosophy of ethics, and application this in a particular situation. I think somebody has put a question related to empathy also. Empathy. And we should place ourselves in that particular situation. Then only we can act in a fruitful way, because we can save a life. So many people are like this. And there is a difference also in rural areas and city areas. What an incident happens, how people react. There were many studies done by sociologists also. How people react. When people are well off, people are educated, mostly it is said, I am not generalizing, many places they say that they don't respond to positively to these situations to help people. But sometimes some other people from other backgrounds may be willing to take up this responsibility. It's everywhere we are getting in news and TV, authorities are saying. So we should have a proper philosophy of education. It's not, as I am repeating, this is not the lack of any philosophical principles, but only application of these principles in a particular situation. There is some kind of lack. That is a role of philosophers, philosophy students and researchers to find a means for this. So that's some possible. Because tomorrow you may be, I may be there in that particular place. That we have to think, that kind of empathy we have to see. Then only some problem can be solved in this way. Okay, thank you for that question.
Okay, next we move on to a very encouraging comment, not really a question, a very encouraging comment from our beloved former principal Kamini ma'am. She says, I feel philosophy has got a tremendous place in today's COVID-19. Each one of us has an important role in containing the spread of this deadly disease. Would the resource persons like to respond to this comment?
Yes, thank you, Kamini teacher. I'm very happy that you are here to hear our responses and talk. And it's actually there. Actually, we have a great role to play.
Yes, we have a great role to play. Each one of us got
each one of yes, each one of us has a great role to play. And the only thing is how we apply this in a particular situation. That we should reflect upon it.
Exactly.
Then Indian philosophy, I just want to add one thing. Indian philosophy, one of the method which they adopt is called introspection. Psychologists are also using it. Introspect, look inwards and see, put questions to ourselves. One more model which from philosophy I am telling is that whenever you will be able to criticize yourself, what we do actually, we criticize others. Instead of that, you criticize yourself. Critically look at your own actions. Then you can do wonders. Thank you.
Thank you, Kamini ma'am. You're absolutely right. Thank you for the compliment given to philosophy, I believe. Thank you.
Okay, we move on to a very significant question posed by Anisa. The question is directed to Dr. Lakshmi. She asks, ma'am, can you explain the application of philosophical counseling in this context of this pandemic situation? I'm sure that this question is very significant, and we would love to hear the response of both Lakshmi teacher as well as Padma sir regarding this question. Thank you.
I think first Padma sir can answer this question because it is more his area. Okay, sir, please.
It's not my area alone, it is everybody's area. Okay. Very interesting question. You see, philosophical counseling is a very interesting area. And I think we have got a, there is a center in University of Kerala, philosophical counseling and research, and director Dr. Veena Isaac is also here at the meeting, I think. I'm also associated with that. How can we apply philosophical principles for counseling? I just cite an example. You see, a Greek philosopher, Greek school of philosophy called Stoicism. I think most of you have heard of Stoics, Marcus Aurelius, something like that. They have got a wonderful theory. They have got so many theories. I'm not going into the details. Only one aspect I'm just highlighting. Why people feel depressed? One question. Yeah, most of us, we feel depressed. I tell everybody to think about it. The basic theory says that we have to classify things in two ways. Things which are within your control and things which are out of your control, or things which you cannot control. Suppose things which are not within your control, if you are worried about that, you will be worrying all in the whole lifetime. You will be worried because you have to change, because you cannot change. So you are coming to the college, you are worrying about, or you have an anti-attitude towards principle. You cannot change the principle or professor. You cannot change your father and mother. You cannot change your sister and brother. But there are things which you can change. So this is one theory which I just want to say, because in every philosophical elements, including Socrates to the existentialist situation, they have got existential therapy also. It has been used both by philosophers as well as by psychotherapists, deal with human problems. We have got very beautiful models in philosophy, and it is being applied very well, because this is a very vast area. We cannot go into details now, but we have got enough tools in philosophy to deal with human problems, especially in counseling. That's why this philosophical counseling is very prominent in many countries, including America, Russia, England, and there are very good philosophical practitioners also. This is also called philosophical consultancy. You can get into the TED Talks or in YouTube and see how philosophical counseling works. You will get details there. You have got beautiful discussions and interviews and classes or lectures on philosophical counseling from each philosophical point of view. This is the only thing which we can respond in this way only, because it's a very vast area, we can use it. And for more details, we are conducting courses also there in this center. You can read also more about philosophy. The materials are available. Even net also is available. Books are also available. Thank you for the question. I think Lakshmi will also comment about this.
Yes, sir. You have given a very beautiful reply. As you have rightly said, philosophical counseling is gaining a lot of importance nowadays. So it's good that you asked that question. Thank you.
Okay, we move on to the next question. The question is from Dr. Nasneem. The question is, sir, though empathy is what is expected in a crisis, it is being substituted with selfishness on an alarming scale. Is it not because of the fear of isolation that propels people to behave so? Isn't it here that philosophical interventions are required?
I think Nasreen is asking a question to me.
Yes, sir. Yes, sir.
Yeah, that's a very interesting question. You see, intervention is required actually. Empathy may lead to selfishness. That's a very wonderful insight. But empathy should not lead to selfishness. Empathy should actually develop. Some other noise is coming, I think. Yeah, that's not happen. Empathy should be useful for the welfare of everybody. We have got a welfare ethics, welfare economics, like that, or a kind of reverence for everybody. That should be there, because empathy can change the attitude of people. I think even selfishness can be overcome by a type of empathy. You should place empathy should be realized properly. Otherwise, it may lead to selfishness. As I think that's what Nassim has, I think, intended. Otherwise, you should use properly that empathy. Realize the empathy in a proper way and apply it. Then it can lead to a better course of action in an altruistic way, not in a selfish way. We should move from altruism, selfishness to altruism. That's what we have to do. Many people have got this problem. Many persons have got this problem. They're still stuck on to. When we think about the humanity in general, especially, I think one of the comments given by here, and I think Lakshmi has also given, pandemic, this crisis has given us a kind of reflection that life is insecure, as existentialists used to say. In that situation, if everybody is insecure, what will happen? If everybody is insecure, and when diseases are socialist, they don't have any kind of partisan attitude towards anybody, can be infected to every individual. So, empathy is a very beautiful concept. If it applied properly, can be useful for the welfare of everybody, especially developing altruistic tendencies in people. I think Nassim will be happy. I don't know.
Thank you, sir. The next query is from Nandita Maisnam. She says that the stigma of positive people coming home after being treated lead to suicide. So how can we tackle this?
After being that, I think I don't know about the import of the question. Question has, I think you have to reframe the question, isn't it? Stigma of the people, positive people coming. After that, they have got this suicide. I don't know whether we have got instances like that. Even if it happens, it may be due to some of the impact of that. Mostly, I think I have noted it. I don't know about this particular issue. Mostly, I have noted that people who are being treated in hospitals, it's usually happening there, or people who are isolated. You have seen some instances in Trivandrum Medical College also, committed suicide, being treated for this, when they are treated in the hospital itself. After coming home, I don't know whether it may be, if it happens, it may be due to some of the feelings or treatment. If they come back, it is attitude of others, attitude of relatives, attitude of neighbors, attitude of society. That's very significant. Because that's very, that I told you, that stigmatization we have to overcome. Stigma is becoming very prominent now. That's very prominent in our society. So which is our duty. I still say that philosophy, fraternity has the duty to analyze this stigma. And for that, we should ask ourselves the question, whether you have stigma, whether I have stigma towards something. That's only in that way we can find a solution for this particular issue. That stigma is actually causing this kind of issue, problems, and that reflection on that stigma has to take away. For that, in order to avoid the stigma, we should be aware, we should have a scientific awareness and scientific knowledge. Latest research in this particular field has to be taken into consideration. For example, I tell you one thing, because I have some contact with, I used to ask a conversation with the doctors, medical doctors, regarding the issue of dead body. Whether these viruses will last in dead body. Viruses will be there in dead body for some hours. If it is properly packed and if you do not touch them, it will not do any harm. After burying the dead body, it will not be, the virus will not be available for attack, because it will be dead. This is a scientific truth which has proved already. But people have got a stigma towards that by saying that if you bury that body. A very interesting thing which I want to tell you is that in Kerala, recently when there's a problem with the burying of the body, somebody objected it. Finally, people have to come. Police have to come. One of the reasons which they pointed out is that when it's burned, it will be in the air. Virus will be in the air, and it will come, and when we do this breathing, virus will be going inside. Finally, an agreement has reached. We will do it in the midnight. That people, when we will be sleeping. And they made a beautiful comment that a scientific thought, I don't know which scientific science is this. When we sleep, you burn it. They have a feeling that when they sleep, they will not be breathing. This is the kind of thought which people have developed. Okay. Thank you.
Thank you, sir.
Yep.
The next question is from Oinam Sarita. She has asked, already human mind has become affected by COVID-19, and how can this pandemic tension be normalized, even though we are not affected by the virus? Thank you.
Question is to anybody?
Yeah, it is an open question, yes.
Okay.
Sir, you please. You please, sir. You please. Yes.
Yeah, okay. You see, the pandemic situation now, you see, the philosophy of corona is now that live with the corona. That is a philosophy. Doctors used to say, medical persons say, WHO says. They have developed a graph, especially in India. I think all of you should be knowing that scientific reports. By August and September it will be maximum. After that, it will come down. So we should have a mentality. Our body is affected, our mind is also affected. That's the problem. The body is affected, we are trying to find out a vaccine for that. For the mind, the vaccine can be given by thinkers, philosophers, teachers, and the public, educated persons. Then only we can do something for that. Mind, vaccine for the human mind. That is what we are giving this. We have found out so many vaccines that the vaccine is not being properly used by people. Because we should get a kind of positive attitude towards corona. Actually, corona is the COVID-19 is the disorder is actually a mild cold, but in some people it causes certain kinds of disturbances, especially people which are affected by. Because these are reports from the doctors. Capillaries will be affected, and that's why many persons have got heart attack. If you have got certain disorders, other disorders, then you will have you are prone to have a severe attack. Otherwise, it will be a mild one. And we should not be panic. That's the basic thing which we have to develop in our mind. And there are so many. You see, the health workers are directly contacting patients and doing services for them. And we should do that. This is attitude is very important. That's why I told you about that movie also. Those who have not seen that movie, I think you see that Sushant movie, last movie before his death or suicide. A beautiful movie about the attitude of people. Another one is also there from the movie also. I just give you, mostly youngsters are here. Amitabh Bachchan has got a beautiful movie, but he is also having COVID-19. 101 Not Out. I think that's the title. The old age person he is acting, and his attitude towards his son. Son is very lethargic, and he is planning for his son to send him to a old age home. Father asking, planning for his son to old age home, like that very beautiful movie. Attitude of people, that makes you important. That's what philosophy has to do. Okay.
Okay, so thank you, sir. The next question is from Amalendu JV. She has asked, ma'am, how can we convey the importance of social concern in this pandemic situation through philosophy in an effective manner? We can see more selfish acts in this period. So how can we make a change in the mindsets of these kinds of people through philosophy? This is a question.
Yes. Okay. Thank you, Amalendu. So this is what we are discussing for this past, I think, nearly 1.5 hours. Because the attitude or whatever philosophies we speak, it shall be mainly for changing our attitudes, as Padma Umar sir has also said. Because attitudinal change is something which is very important, at least during these times of crisis. Let us start thinking about the other. I mean, let us at least see the sacrifices done by the health workers and change our attitudes. I think philosophy is carrying out this message, and we have to act as models. Okay, thank you.
Okay, we have